Hi there and welcome back. We recently reviewed narcolepsy in our prior session, and let's continue this session with understanding sleep apnea, and we'll get into the apnea index or AHI. What are the mnemonics? RERA, RERA, UARS and RDI that you will frequently notice while reading the medical records that you order to uh, assess the extra mortality due to the sleep apnea. Uh, there are different types of sleep apnea, so we'll get into the obstructive sleep apnea, central sleep apnea, mixed sleep apnea, and bottom line, how do we underwrite? Okay, so let's start. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts. Sleep apnea is characterized by inadequate ventilation, that is due to either obstruction of the upper airway called obstructive sleep apnea or inadequate respiratory drive from the central nervous system called central sleep apnea. These mechanisms can coexist and hence called mixed sleep apnea. Let's define these terms apnea, hypopnea and apnea hypopnea index or AHI. Apnea episode during sleep is the cessation of airflow for at least 10 seconds. Okay. Hypopnea is a reduction in airflow lasting at least 10 seconds and associated with a 3 to 4% decrease in oxygen saturation despite inspiratory effort. That's hypopnea. And apnea hypopnea index or AHI is equal to the number of apneas plus hypopneas divided by the number of hours of sleep. Remember, it is an index. So you are adding this to apnea plus hypopnea and then you are dividing it by the number of hours of sleep to arrive at the AHI. Okay. And you will see different ways in the medical records these things are described. Let's move on. What is RERA, UARS and RDI? RERA or RERA means respiratory effort related arousal and is a respiratory event associated with arousal that does not meet, I repeat, that does not meet criteria for hypopnea or apnea. Okay. UARS means upper airway resistance syndrome and is a frequent awakening due to RERA with daytime somnolence, and here AHI is normal. The next is RDI or Respiratory Disturbance Index, and it means apneas plus hypopneas plus RERAs divided by the number of hours of sleep. So if no RERA are detected, then RDI equals AHI. Agree? If you follow the definitions of all these terms, very logical and simple. What is obstructive sleep apnea, OSA? OSA or obstructive sleep apnea is associated with oxygen desaturation, frequent arousals from sleep and sleep fragmentation, excessive daytime sleepiness, sometimes quantified in medical records by the Epworth Sleepiness Score, chronic loud snoring, frequently provoking complaints from bed partner, and gasping or choking during sleep. OSA is an independent risk factor for increased incidence of motor vehicle accidents, pulmonary and arterial hypertension, stroke, and ischemic heart disease, and hence is considered as associated with increased mortality. The diagnosis of OSA is achieved by a sleep study called polysomnogram, which measures the multiple physiological parameters during sleep, including oronasal airflow, contraction of the muscles of respiration, and oxygen saturation. If the AHI is 5 or greater, okay, pay attention. If the AHI is 5 or greater in symptomatic individuals, or 15 or greater in those who are asymptomatic, OSA is considered to be present. Treatment for the OSA include, as a starting point, stop smoking if you are a smoker, lose excess weight, exercise, avoid alcohol and certain medications, sleep on your side or abdomen rather than on your back, are the initial starting point suggestions that you will see from the doctor to the potential customer of yours who may be on his way to become or to end up having a obstructive sleep apnea. Additionally, nasal continuous positive airway pressure, or the CPAP that you will normally see frequently, orthodontics devices, nasal sprains, plus surgical approaches such as tracheostomy, uvulopalatopharyngoplasty, that is UPPP, or linguloplasty or mandibular advancement, plastic remodeling of the uvula, that is with the laser assisted or radiofrequency ablation, have been considered. CPAP is more reliably effective than oral appliances, but oral appliances may be easier to use. Some are designed to open your throat by bringing your jaw forward, which can sometimes relieve snoring and mild obstructive sleep apnea. Okay, so let's enough on the OSA or obstructive sleep apnea. Let's move on to the central sleep apnea. CSA or central sleep apnea. In CSA, the neurological signal to breathe is absent. The apneas or hypopneas are the result of brainstem or other neurological failure to continue breathing during sleep. The CSA is characterized by absence of both ventilatory effort and oronasal airflow. CSA is nearly always due to a serious and often uninsurable medical condition such as congestive heart failure or stroke. The CSA may coexist with OSA, and if so, then known as mixed sleep apnea. Central apneas are often seen in chronic consumers of opioid drugs. Mixed sleep apnea, as just said, mixed sleep apnea is characterized by components of both central and obstructive apneas and or hypopneas occurring during the same polysomnogram. If the number of central apneas or hypopneas is more than 50% of total apneas or hypopneas, a diagnosis of central sleep apnea can be established. Okay, so sleep apnea, these are the different terms you will frequently see in medical records that you order to assess and price the sleep apnea or the extra mortality. Obstructive sleep apnea you will see more frequently. You may see central sleep apnea once in a while in the medical records, and there may be a potential customer with mixed sleep apnea. So how do we underwrite? The definition of mild or moderate or severe, depending upon the company's ongoing research, the data that they use, they correlate with the claims that they go through and review. You will see the variation in the definition of mild, moderate and severe, because every company, they have got their own unique claim experience, their unique actuarial data, their ongoing research, and they try to correlate to come up with the pricing structure for the variety of products that they offer. Try to plug those details and be careful. You follow your manual, you follow your company specifics, because a case could be a mild, that could be a moderate for a different company, although they are looking at the same medical records. Okay, so with that, let's take a break here and see you soon. Take care. Bye now.